it going, you guys? Something different. How you doing? Good, good. Nice to see you guys. Awesome. Thank you.
Hey, how are you?
I'm great. You know, good afternoon. Good afternoon, and thank you, everyone, for being here today at what is a really, really important signing. You know, we do a lot of work in this building, and as I think back over many years, I don't know of an issue that's had a bigger impact on families across Massachusetts, across this country, than the opioid crisis. And I've had the privilege of working alongside many of you, including many advocates, family members, community members, who are joining me and our wonderful legislative partners in the administration here today, standing with us, and also in the audience or even listening at home. And I just want to begin by extending my heartfelt thanks and gratitude for the courage of families to continue to tell the story, tell what happened to their loved one, the bravery of those who are in recovery, who are battling addiction. This is a disease that knows no bounds. It touches and can touch just about any family, anywhere, regardless of race or religion or neighborhood or socioeconomic status, right? We know that. The wonderful legislators here with me know that. They hear from a wide spectrum of constituents. And so today, yeah, sir,
overdose prevention centers would make it possible for those people to move towards health and stability, and most importantly, save their life. And why haven't you been more willing to take a leadership role to try to make that happen?
You speak to, okay, so listen. Okay. You know what, sir? You can talk to others about, you know, if you want to have more policy ideas on harm reduction, but as a person who was the first to investigate and sue members of the Sackler family, to sue Purdue Pharma, to recover several hundreds of millions of dollars that is funding important treatment strategies, including, sir, harm reduction. Today, as I was saying, I think today for all of us is about the victims. Because it kills me that so many have suffered. It really kills me that so many have been in pain, in many ways at the hands of and through the greed of companies, corporations that would exploit people's pain for their own profit. And I'm grateful to the work of many in terms of rectifying some of that, changing practices. But we also know there's more work to do. And that's what today is about. So I am grateful to be here today, grateful to be here alongside Senator Crighton, Representative Madaro, members of the legislature who are here, who have acted time and time again when it comes to addressing issues of substance use disorder. And this is another example of that. We're also joined by our Undersecretary for Health, Kiame Mahaniah, Undersecretary for Health and Human Services, Mary McGeown, our Commissioner of the Department of Public Health, Dr. Robbie Goldstein, DCF Commissioner Staverne Miller, DMH Commissioner Brooke Doyle, our BSAS Director, Dee Calvert, Maria Mosaides, Office of the Child Advocate, and special thank you as well to colleagues from the Public Safety and Security and from the Executive Office of Public Safety and Security and from the Department of Corrections for their important and generous collaboration on the Section 35 issue that we were able to work through. This could not have been done without your support. And it's something that's needed to happen for a number of years. We all were determined to get it done, and I'm just so grateful to everyone who worked on this. We are joined today as well by, I mentioned our conferees, Senator Crighton, you'll hear from shortly, Rep. Madaro,
Representative Alice Peisch, Senator Julian Cyr, Representative Marjorie Decker, Representative Kate Donahue, Representative Jim O'Day, Representative Sean Garbely, Representative Jay Livingstone, former Representative Smitty Pignatelli, Senator Collins, Representative Howard as well. Have I missed anyone? Okay, good. I also know, though, there isn't a legislator in this building that doesn't care an awful lot about seeing this through, whether they're here today or not. We also have our chairwoman, Melissa Ferretti, from the Herring Pond Wampanoag tribe with us as well. Advocates, you'll hear shortly from Mr. Sierra, who's now the executive director of MORE, and he is stepping into the big shoes of Marianne Brangulis, who has been a champion, who's joining us here today as well. Cheryl, where's Cheryl? Where? Yep. Hey, kudos to you on the license plates, too. We're going to get those out. It's great. And Dina Favreau is here as well, among other advocates. Experts in public health leaders, Dr. Joshua St. Louis, Director, Massachusetts Society of Addiction Medicine, Dr. Sarah Wakeman, Mass General Brigham, Dr. Miriam Kamaromi was the medical director of the Graken Center, great work that Graken's doing. Oami Amarashingham, the deputy director of the Massachusetts Public Health Association. Julie Burns, president and CEO of Rise Mass. Lydia Conley, president and CEO of the Association for Behavioral Health. Rachel Gwaltney, executive director, Children's League of Massachusetts. Peter Barbuto, president and CEO of the Gavin Foundation. And Frank Callahan of the Mass Building Trades, a leader in workplace outreach for substance use disorder. Look, I said a lot at the outset. I'm going to turn the podium over to my colleagues, but I just want to say that, we know that treatment works when health care is the answer, right, and not punishment. We know that naloxone is life-saving medication. It's important that we continue to make that available. We know that taking medication for opioid use disorder should be supported and not the subject of stigma. We know that recovery coaches do incredibly important work and should be treated and supported as the professionals that they are. And we know that the presence of a substance does not by itself justify stigmatizing a mom or separating her from her child. And that someone who is helping others to stay safe and to reduce harm is doing a good thing and should not be punished for it. So these are all important steps, but know from the bottom of my heart that this is just another step in what is an ongoing journey and work to address addiction, to support recovery, to end stigma, and to give individuals and their families life back, the fullest of life experience that we'd hope everyone has the opportunity in this great state to enjoy. So thank you to the legislature for bringing this forward, and I invite up to the podium Senator Brendan Crighton, who's been a tremendous leader and head of the conference.
Thank you, Governor. I know it's been a busy few weeks. I hope you're not running out of pens for these bill signings. We appreciate your partnership. And kidding aside, as you can see, our governor is tremendously passionate about this. She's courageous, and her entire administration is not afraid to be bold. They've been wonderful partners to us in the legislature, and we're very excited to start this next session and to build on that work. I hate to give shout-outs to individuals here, but I have to give a shout-out to a member of the administration, Undersecretary Kiame Mahaniah, who while he continues to do the great work here at a statewide level, I know him as Kiame from Lynn Community Health Center in Lynn, and as a legislator and a local official, any time that I dealt with either a constituent case, a policy case, or anything under the sun dealing with mental health or substance use disorder, I called Kiame, and every time he answered and every time he was helpful, and he continues to do that now in his new role. So thank you so much, Kiame. I'd also like to thank the Senate President for her continued steadfast leadership in making policies and investments around substance use disorder to be a priority, not for one legislative session, but every legislative session. And I thank her for letting me be a part of this on the conference committee. I'd also like to thank our conferees, Senator Vilas, Senator Fatman, Chair Madaro, who you'll hear from in a minute, Leader Peisch, and Rep. Soder. It was just wonderful to work together. Obviously, a number of policies, a number of bills, and you can see many of their legislative sponsors here today that came together to create this game-changing piece of legislation. And Senator Vilas, as chair of the committee, has been such a tremendous resource for all of us in the legislature, and in particular during this conference committee. He is not here today because while he serves as a state senator, he is also serving our country as a member of the National Guard, and he has mandatory training. But certainly he has played a crucial role in all of this. And I want to give a very special thank you to everyone that's here today, everyone that has shared their voices and continue to share their voices, to tell your stories, as difficult as they may be. It takes a great deal of courage to do so. And to all of those who work every day at the ground level to make sure we are saving lives and we're getting everyone on a path towards recovery. Today we're here to celebrate a piece of legislation, a game-changing piece of legislation, but as the governor mentioned, it's so important to remember all the lives that we've lost to substance use disorder, to all the families that continue to mourn their loved ones, the loss of loved ones, and those that continue to struggle and fight. The opioid epidemic has sadly been devastating our communities for over a quarter of a century now. And I'm proud of what Massachusetts has done over the years to remove the stigma of addiction, to treat substance use disorder not as a criminal matter, but as a public health issue, and to make sure that there's funding, access, and resources that are there for treatment. This bill being signed here today builds on so many of those efforts. And while we've made great strides, we must continue to do the work. We must continue to build off this success. And as I said, I'm excited to work with the governor, with all of our fellow legislators, and all of you here today in this upcoming session. It is now my honor to introduce a great friend, a legislative partner on so many matters, in the House Chair of the Mental Health, Substance Use, and Recovery Committee, Adrian Madaro.
Good afternoon, everyone. Senator, thank you for your friendship over so many years, and most importantly, for your partnership on this piece of legislation. Good afternoon. It is a pleasure to join you all at the ceremonial signing of an act relative to treatments and coverage for substance use disorder and recovery coach licensure. First, let me thank Governor Healey for your very swift passage of this act, as well as my House and Senate colleagues for assembling a package that really centers the dignity and value of people in recovery. In particular, I want to thank Speaker Mariano for his leadership and commitment to furthering accessible treatment and support services for people with substance use disorder. I also want to thank all of the legislative staff who supported us in developing this legislation, and in particular my team, whose efforts were vital in getting this bill over the finish line. Today, as you know, overdose remains the leading cause of death of people aged 18 to 45. Overdose rates among people of color, Black and Latino men in particular, have more than doubled, highlighting the disproportionate impact public health crises have on communities of color. We continue to lose far too many lives to overdose, which is why this legislation is so timely and important. This act is the culmination, really, of years of extensive discussion, analysis, and conversation with legislators, experts, and community stakeholders, including, and importantly, people with lived experience. It reaffirms Massachusetts' twofold commitment to prevent and reduce the fatality of overdoses and support and expand access to recovery and treatment. To reduce barriers to obtaining opioid overdose reversal drugs, this legislation mandates insurance coverage without cost sharing or prior authorization and requires pharmacies to maintain adequate supplies of these life-saving products. To ensure patients receive pain treatment grounded in best practices, it expands prescriber training on non-opioid alternatives to pain treatment, requires pharmacists to distribute educational materials on non-opioid alternatives when dispensing opioid prescriptions, and requires health plans to ensure coverage and access to non-opioid alternatives. To address growing drug supply contamination and align our laws with the statewide harm reduction strategy, this act protects harm reduction workers utilizing drug testing equipment and people seeking drug checking services at harm reduction programs. To support mothers and birthing parents in recovery, this bill mandates a collaborative approach to assessing the safety and care of substance-exposed newborns. This means that a parent who is simply taking medication for addiction treatment prescribed to them by their healthcare provider will no longer automatically require a report for abuse or neglect, a practice we all know disincentivizes mothers from adhering to their addiction treatment plans. This act also enhances anti-discrimination protections for people taking medications for addiction treatment, people covered by life insurance policies who obtain opioid overdose reversal drugs, and people covered by public health insurance who seek treatment at DPH licensed treatment programs. Additionally, this legislation requires the Commonwealth's executive agencies to develop a plan by 2027 to ensure that men receiving court-ordered substance use treatment are not sent to correctional facilities. Instead, this plan will ensure these men receive care in more appropriate clinical settings. Finally, this act implements long overdue changes to how we treat recovery coaches and the invaluable services and supports they provide by mandating insurance coverage of services provided by licensed recovery coaches without cost sharing or prior authorization, and establishing recovery coach licensing and oversight within DPH. And to ensure recovery coaches themselves receive the support they need, this act establishes a peer support program for both recovery coaches and their employers. Folks, the consequences of substance use have impacted all our families and all our communities. This bill ensures that we continue to make substance use disorder treatment and recovery support more affordable and accessible here in the Commonwealth of Massachusetts. With that, I'd like to introduce the next speaker, my friend Noel Sierra, who is the new Executive Director of the Massachusetts Organization for Addiction Recovery. And before he comes up, and I have to say, Noel, we are so thrilled that you're taking the helm of MORE. But before you come up to share a few words, I want to just take a moment to thank you, Marianne. We all know Marianne Frangoulis, the longtime former Executive Director of MORE. You know, both Noel and Marianne truly have served as indispensable thought partners and leaders on policies affecting people in recovery, and I am so grateful for their contributions to this bill. Please join me in welcoming Noel Sierra for MORE.
Good afternoon, everyone. To sit here and read through and hear everything that was just shared, first and foremost, I want to thank the Mental Health and Substance Use Recovery Co-Chair, Representative Adrian Madaro. Thank you so much for everything that he just shared, all the hard work for introducing me as Executive Director at MORE. I thank you, and I also want to thank Senator John Vilas. He's not here at the moment, is what we heard, in his role as Mental Health and Substance Use Recovery Co-Chair, for listening to the voice of the recovery community. To be able to move forward and listen to individuals with lived experience, as well as the many organizations who supported important laws which positively impact prevention, treatment, harm reduction, and recovery supports for all the residents in the state of Massachusetts. It really expands multiple pathway options that we need for treatment when it comes to recovery. I'd like to thank Mary Ann Frangoulis, our former MORE Executive Director, and now myself as a person in long-term recovery, for spreading the MORE mission to the organizations, to recovering individuals, families, and friends into a collective voice, to educate the public about the value of living in recovery. We're so grateful to be a part of a movement that has led to 39 recovery support centers throughout the state of Massachusetts. Peer recovery coaches within building of the ROSC, which is a wellness recovery-oriented system of care. Now with these new laws, we're able to have licensure for recovery coaching, government and health insurance authorizing peer recovery coaching, protecting the fidelity of peer recovery coaches, providing that handheld badge or bridge to recovery, supports within the continuum of care, managed by the Massachusetts Department of Public Health, Bureau of Substance Addiction Services. We thank you, BSAS, for your support. We thank the peer recovery coaches who spoke up about what needed to happen to make the important move develop. Thank you, Representative O'Day, you're here with us. Senator John Keenan for sponsoring this move. We are ever so pleased that men who are suffering from addiction will so hurtfully that they have been mandated to Section 35, that means that their addiction is not at a point of harming themselves or others. It is at a point of harming themselves or others. But they don't have to go to a facility that's run by the Department of Corrections because they haven't broken a law. They need treatment, and we thank you for that. If anyone that's suffering from addiction and they in this way and they have not committed a crime, they shouldn't go to prison, and that's definitely something that we believe and that we think is true. We are ever so pleased to see now that moms who are following a medication-assisted treatment recovery plan will no longer have to be referred to a 51A as to the Department of the Children and Family solely because there is an opioid in their system. This discriminatory practice is being removed, and I can only applaud that even more. The idea that it further calls for interagency support, which is so needed and so important. Thank you, Senator Joan Comfort and Representative Sean Garbali, for leading this move. We thank you all, the recovery community members who share their stories and provided researchers, the medical experts, the advocates, the policymakers, and state agencies. The law reinforces that all health insurance must be recognized for addiction treatment coverage. It expands acupuncture as a detox method, expands Narcan availability, prescription education, non-opioid treatment availability, as well as commissions on substances such as xylazine and benzodiazepines. Thank you to the conference committee, led by Senator Crighton. Thank you so much. And Representative Madaro and House Speaker Mariano, Senate President Karen Spilka, and state legislator, the advocates for the law, a reality with all lived experience. We are all visible, vocal, and valuable. And of course, Governor Moore Healey, thank you so much. You have been a strong advocate for recovery. You have been a strong advocate in supporting the movement. And thank you, Governor Healey, for making this possible and signing these bills. Thank you all.
Thanks, everybody. It's a wonderful, wonderful thing. And again, special gratitude for those who lifted their voices, told their stories, told their families' stories. Know that here and for this day forward, I know that will continue to guide the work. So continue to speak out, continue to speak up, and we wish everybody the very best in this new year, 2025, and what is, I know, an ongoing effort every single day. And we are inspired by the resilience, the persistence of those who are in recovery, and those who are attempting recovery, and those who are wanting recovery. And today, let this be some, I hope, comfort to you that your government here, represented by all of us, is all in and all behind you. God bless you and your families.